You're listening to OET Roleplay Practice with Kev, the English native.
Hello, it's Kevin here. So, time for the new nursing audio roleplay for OET. It's been a week or so. Sorry I haven't been able to produce anything sooner, but very busy these days on italki and YouTube. Links below, of course, if you need anything. Anyway, in this nursing roleplay, it's nurse, and you're dealing with the mildly anxious parent of a 6-year-old who needs an MRI scan. So in this role play, you'll be explaining how the scan works, trying to reassure the parent, generally being empathetic and sympathetic and as reassuring as possible. So, as always, you can use it for pronunciation practice, as a shadow, copy that. There's a transcript mapped to the criteria, A, B, C, D, E, so you can see some good phrases that you can use there. And also, I've now started making a script for AI that you copy and paste. I've made a video about how that works. You can use it for nursing as well. Links to that will be below. So, have a listen. Hope it helps.
Hello, I'm Evie, one of the nurses in the emergency department. Thanks for waiting to speak with me. Before we talk things through, can I just check? You are Mrs. Dean, and you want to talk about your 6-year-old son, Kevin, who's had headaches and some vomiting for about a week.
Yes, that's right, nurse. I'm Kevin's mother.
Okay, thank you. The doctor has asked for a special scan of Kevin's brain called an MRI. I'm here to explain exactly what will happen and answer any questions you have. How does that sound?
That would be good. I'm really hoping this will help him get better soon.
I completely understand. Most parents feel the same in this situation. Before I explain the scan, can I ask, what have you heard about MRI scans so far?
To be honest, not much. I just assumed it was like an X-ray or something.
That makes sense. A lot of people think that. An X-ray is a quick picture using a small dose of radiation. An MRI is different. It uses a strong magnet and radio waves, not radiation, to make very detailed pictures of the brain, so doctors can see exactly what's going on.
Okay, so there's no radiation with this one?
That's right, no radiation at all. It's a safe and non-invasive test. The machine looks like a large tube with a bed in the middle. Oliver will lie on the bed, and the bed gently moves into the tunnel so we can scan his head. The whole brain scan usually takes around 30 to 45 minutes.
That's longer than I expected. I'm not sure he'll manage to stay still that long.
We'll do everything we can to help him, like explaining it in child-friendly language and using headphones. But for a scan this long, the doctor is recommending a light sedative so he can relax and sleep through most of it.
I really don't like the idea of him being sedated. I'm worried about side effects.
It's completely natural to be anxious about any medication, especially for your child. Let me explain a bit more so you can weigh up the risks and benefits. Is that okay?
Yes, please. I need to understand it properly.
We usually give a small dose of medicine by mouth, sometimes through a vein if needed. The aim is not to knock him out completely, but to help him feel sleepy and calm so he doesn't move. A doctor and nurse will stay with him the whole time. We'll be monitoring his breathing, his pulse, and his oxygen levels throughout.
And what about side effects?
Most children just wake up a bit drowsy or grumpy, and that wears off within an hour or two. Occasionally, they may feel a little sick or have a headache or be irritable for a short while. Serious complications are very rare, and we are fully equipped to deal with them if they happen.
I understand. I just don't want him to go through anything he doesn't absolutely need.
That's perfectly natural to feel so, but if we don't do the MRI, the doctors have far less information. With his headaches and vomiting, they need to make sure there's nothing serious causing those symptoms, things that might need treatment sooner rather than later. The scan helps them see the brain in great detail and either find a problem early or reassure us that nothing serious is there.
So if we don't do it, they might miss something important?
Exactly. And that's what we're trying to avoid. In most cases, the scan either confirms that everything is fine or it pinpoints the problem so treatment can be started quickly. The risk from the sedative is small, but the benefit of getting clear answers is quite big.
I see what you mean. I just wish I could be in the room with him while it's happening.
I really wish we could allow that. However, because the machine is a strong magnet, it's not safe for anyone else to be in the room unless they're checked and wearing special equipment. What we can do is have you in the room next door where there's a window and a camera. You'll be able to see him, and the staff can keep you updated throughout.
So I'll be able to watch, but not sit right beside him?
That's right. You'll be just a few meters away, and if there's any issue, we can pause and speak with you. Before the scan, you'll have time to stay with him, explain that you'll be close by, and we'll make sure he feels as settled as possible.
Okay, that's a bit more reassuring.
Good. I'm glad. Let me just check I've explained everything clearly. So, the MRI is a detailed painless scan of his brain using magnets, not radiation. It takes around 30 to 45 minutes and he needs to lie very still. Because of his age, we strongly recommend a light sedative so he can sleep through it and we get clear pictures. You'll wait in the next room, able to see him, and we'll monitor him closely all the way through.
Yes, that's my understanding now.
If you choose to go ahead, after the scan, we'll keep him here until he's fully awake and drinking again. If at any point you feel unsure or have questions, you can ask the team looking after him. You're not signing away control. You're part of the decision.
Right. That's important to me.
Given everything we've talked about, the symptoms he's been having, the need for clear answers, and the small but careful use of sedation, how are you feeling now about going ahead with the MRI?
If you promise to keep me updated the whole time, I think we should do it.
Thank you for trusting us. We will keep you informed throughout, and if anything changes, you'll be the first to know. I'll let the team know you're happy to proceed, and I'll come back shortly to go through the consent form and the practical details. Is there anything else on your mind right now?
No, everything is clear now, nurse.
You're very welcome. You're doing the right thing for Oliver. I'll be back in a few minutes and we'll take it step by step together.
So, there you go. Pretty straightforward stuff, eh? Some good phrases that I hope you took notice of. How to show empathy, how to be reassuring, etc. Some excellent stuff there. As I said, transcript available, roleplay card available, links below, all on my learning management system at Notion, and a script for you to drop into AI so you can practice this. And there's a video, another one on my channel, where I instead of having a script and showing you how to use that, which you can do, I have a new one that shows how you can take a roleplay card with a master prompt, which I supply, and you drop that in to chat, and it will react in the same way like a real patient or interlocutor consultation. So you've got different options here. You can listen to the audio, you can shadow that, you know, get your memory working there, pronunciation. You can drop the script in, so you can have live practice with probably chat. Chat is best, and it'll read the same patient lines as a script. And now also you can drop a roleplay card in with my master prompt and have some live practice where chat will not read exact verbatim lines like a script, but will instead hallucinate, as in make things up, but based on the task. So that's more realistic. Anyway, hope that helps. Have a listen. Any questions, contact me anytime, links below, etc. Okay, I'll see you next time.
Thanks for listening to OET Roleplay Practice with the English Native. Join me next time for more practice and tips.